Hello friends, I am Dr. Mohit Shah. I am a consultant psychiatrist practicing in Mumbai. In last video, I spoke about addiction. Now today, I am going to talk about bipolar mood disorder. It's a disorder of the brain where you get episodes of mania, hypomania and depression. Let me explain to you one by one. What is mania? Mania is a state of mind where you feel extremely euphoric, you don't sleep well, you talk things which are not relevant, you spend a lot of money. It can be evident that you are not in the right state of mind. A lot of people in mania behave abnormally. What is hypomania? In hypomania, although you feel euphoric, you feel excited, but your behavior is still normal. Means it is very difficult to make out whether you are in hypomania or you are having a normal temperament. And what is depression? Well, depression is where you feel extremely sad, you don't feel any motivation, you feel like killing yourself, you don't sleep well, you don't get any pleasure in pleasurable activities. Now, to diagnose bipolar mood disorder, it's sometimes tricky because sometimes even the normal behavior can be interpreted as having a hypomania, or a normal sadness can be interpreted as depression. But if you feel that your mood swings are very erratic, means you fluctuate from 2 days you are feeling extremely excited and extremely happy, and then for suddenly 2 days you feel extremely low, you may have symptoms of bipolar mood disorder. What are the treatments available for bipolar mood disorder? First and foremost, you need to see a psychiatrist who will take a detailed clinical history, do some psychological tests, and after the assessment, he may diagnose you as having a bipolar mood disorder. The treatments available are medications. Medications generally given to bipolar mood disorder patients are called mood stabilizers. What is mood stabilizer? Mood stabilizer is a medicine which keeps your mood stable. You will not develop mania, hypomania or depression. It will keep your mood stable. Exercise helps in patients of bipolar mood disorder because if you do regular exercise, your mood becomes much more stable. Also, it's very important to look after your sleep. If you sleep well, your symptoms of going into mania, depression reduces. Also, if you consume any drugs on a regular basis like alcohol or cocaine or MD, it may push you towards developing a bipolar mood disorder because these drugs stimulate the brain and you may have mood fluctuations because of it. Sometimes if the bipolar mood disorder is serious, in a sense that if your depression is so bad that you want to commit suicide, or your mania is so bad that you are doing things which are extremely fatal for you, then you may need admission in an acute psychiatric facility, because when you are in this state of mind, when you are extreme in a manic state, you don't realize that you have a problem, you refuse treatment, you don't want to see anybody. Sometimes the family members or relatives may admit you without your consent, give you treatment. It's a treatable condition, but sometimes it can get serious, so it's very important to recognize the signs. So if you have somebody who's suffering from this kind of problem, or you yourself feel that you may have some proneness to develop a bipolar mood disorder, please consult a psychiatrist. Many a times patient asks me, sir, how do you diagnose a psychiatric condition? Well, it's an extremely good question, because unfortunately there are no blood tests to diagnose a psychiatric condition. So all psychiatric conditions are a clinical diagnosis. We use what is called as DSM-5 or ICD-11, which gives us a list of symptoms of a particular disorder. So suppose I want to diagnose a patient of depression, then there are some 12 to 13 signs of that I look for, and if those symptoms and signs are present for more than 2 weeks, then it is called depression. Yes, sometimes if you have hypothyroidism, it may look like depression. So in very few conditions, you may have a medical disorder which may mimic symptoms of psychiatric disorder. But many a times, without any medical issue also, patient can develop a psychiatric disorder. It's a biological disorder. It affects because there are some neurotransmitters in the brain which get affected. So this is how we diagnose a psychiatric disorder. Thank you.